Hello everyone, and welcome to the Well Baby channel. Today, we will be discussing the details of a cesarean section, commonly referred to as C-section, and the reasons why a pregnant mother might need to undergo this surgical procedure. Whether you're an expectant parent or just curious about childbirth, this video will provide you with valuable insights. Make sure to watch until the last tip, because I'm sure it will be very valuable. Make sure to subscribe to the channel so we can help you as much as possible with your new bundle of joy. Now let's get straight into the video. A cesarean section, or C-section, is a surgical procedure used to deliver a baby through incisions made in the mother's abdomen and uterus. It is an alternative to vaginal birth and is typically performed when vaginal delivery might pose risks to the mother, the baby, or both. There are several medical reasons why a pregnant mother might need to have a C-section. Let's explore some of the most common indications for this procedure. In a breech presentation, the baby's buttocks or feet are positioned to come out first, instead of the head. This can complicate vaginal delivery and increase the risk of birth injuries. A C-section might be recommended to ensure the baby's safety. Placenta previa occurs when the placenta partially or completely covers the cervix. This condition can lead to severe bleeding during vaginal delivery. A C-section is usually performed to avoid potential life-threatening complications. In cases of twins, triplets, or more, the position of the babies can be unpredictable, increasing the likelihood of complications during vaginal delivery. A C-section may be planned to ensure the safe delivery of all babies. If the baby shows signs of distress, such as an abnormal heart rate, a C-section might be performed to expedite delivery and minimize potential risks to the baby's health. A woman who has previously had a C-section might need another one in subsequent pregnancies due to concerns about uterine rupture during vaginal delivery. Prolonged labor, failure to progress, or other labor-related complications can necessitate a C-section to prevent potential risks to both the mother and the baby. Certain maternal health conditions, such as heart disease or active genital herpes, might increase the risks associated with vaginal delivery. In such cases, a C-section could be the safer option. In some cases, unforeseen complications can arise during labor that require an emergency C-section to ensure the well-being of the mother and the baby. Cesarean sections are valuable medical procedures that help ensure the safety of both mothers and babies when vaginal delivery might pose risks. If you're an expectant parent, it's essential to stay informed and have open discussions with your healthcare provider to understand the best approach for your specific situation. Remember, the ultimate goal is a safe and healthy delivery for both the mother and the baby. While there's no guaranteed way to completely prevent the need for a C-section, there are steps pregnant mothers can take to promote a healthy pregnancy and potentially reduce the likelihood of requiring a C-section. It's important to note that some factors leading to a C-section might be beyond a mother's control, such as medical complications or unforeseen emergencies. However, here are a few things that can be considered to support a healthy pregnancy and increase the chances of a vaginal delivery. Attending regular prenatal checkups with a healthcare provider is crucial. These visits help monitor the health of both the mother and the baby and address any potential complications early. Maintaining a healthy lifestyle can contribute to a smoother pregnancy and labor. This includes eating a balanced diet, staying hydrated, engaging in regular physical activity, as approved by your healthcare provider, and getting adequate rest. Participating in childbirth education classes can help expectant mothers learn about labor, delivery, and pain management techniques. Being prepared and informed can reduce anxiety and make the labor process smoother. Having a supportive birth partner, doula, or midwife can provide emotional support during labor and help advocate for the mother's preferences and comfort. Remaining mobile during labor and trying different positions can help progress labor and potentially reduce the need for interventions. Practicing relaxation techniques, such as deep breathing, visualization, and mindfulness, can help manage pain and stress during labor. In some cases, interventions like inductions or epidurals can increase the likelihood of needing a C-section. Discuss the pros and cons of interventions with your healthcare provider and make informed decisions. Strengthening the pelvic floor muscles through exercises like Kegels may support vaginal delivery by improving muscle tone and flexibility. Being knowledgeable about your own medical history and preferences and communicating openly with your healthcare provider can help ensure that your birth plan aligns with your wishes whenever medically possible. It's important to remember that every pregnancy is unique, and the need for a C-section can arise due to factors beyond control. Ultimately, the focus should be on a safe and healthy delivery for both the mother and the baby. pregnant mothers should work closely with their healthcare providers to make informed decisions that prioritize their health and the well-being of their baby. Be sure to tune into our other informative sessions listed right here on our channel. Like a week-by-week journey into your first, second, and third trimesters of pregnancy and healthy exercise and eating during pregnancy. You won't want to miss them. Some additional things to consider. After undergoing a cesarean section, C-section, delivery, subsequent pregnancies will likely necessitate the continuation of this surgical procedure. This assertion can be classified as a myth. The occurrence of a single cesarean section does not necessarily imply that all subsequent deliveries will also be conducted via cesarean section. The provision of counseling services must be highly personalized and tailored to the unique needs of each individual. This inquiry pertains to the initial occurrence and the most secure course of action for oneself and prospective offspring. The predominant proportion of patients who undergo a cesarean section for their initial childbirth will experience the same mode of cesarean section. In subsequent pregnancies, there is the possibility of opting for a vaginal delivery. The following topics should be addressed in consultation with your healthcare physician in order to gain insight into the rationale behind your initial cesarean section. This tool has the potential to assist in forecasting the probability of a successful vaginal birth in subsequent pregnancies. Another factor that contributes to the decision-making process is one's reproductive plans. Is it possible to have another child? May I inquire about the possibility of an additional 5 children? The optimal birthing method is contingent upon individual circumstances, taking into account the preferences and needs of both the mother and the infant. It is imperative to acknowledge that the optimal birthing method varies for each individual patient. Vaginal bleeding is not typically observed during a cesarean section procedure. Vaginal bleeding will be experienced. Typically, individuals experience a decrease in quantity following a cesarean delivery. One contributing factor is that throughout the surgical procedure, efforts are made to eliminate the presence of blood clots and other related substances, which are located within the uterine cavity. Another important aspect to consider is the circulation of blood to the uterus. The level of blood flow experiences a significant increase during pregnancy, thereby facilitating the growth and development of the fetus, as well as providing necessary support to the placenta. Following childbirth, there is a steady decrease in blood supply to the uterus. This phenomenon can be attributed to the presence of increased blood circulation. The process of uterine involution persists and subsequently diminishes as the uterus eventually returns to its original dimensions. Severe headaches are a commonly experienced phenomenon. After undergoing a cesarean section, C-section, procedure, subsequent deliveries will typically require the continuation of same surgical method. The statement made by the user is unsubstantiated and lacks empirical evidence. The occurrence of a single cesarean section does not necessarily imply that all subsequent deliveries will also be conducted via cesarean section. The provision of counseling services should be highly personalized to meet the unique needs of each individual. This inquiry pertains to the initial occurrence and the optimal course of action for ensuring personal safety and the well-being of prospective offspring. The predominant proportion of patients who undergo a cesarean section for their initial childbirth experience will have the typical mode of cesarean section. In subsequent pregnancies, there is the possibility of opting for a vaginal birth. The following topics should be addressed in consultation with your healthcare physician in order to gain insight into the rationale behind your initial cesarean section. This can potentially aid in the prediction of the probability of achieving a successful vaginal birth in subsequent pregnancies. Another factor that contributes to the decision-making process is one's reproductive plans. Is it possible to have another child? Is it possible to have an additional 5 children? The optimal method of childbirth is contingent upon individual circumstances, taking into consideration the preferences and needs of both the mother and the baby. It is imperative to acknowledge that the optimal method of childbirth may vary for each individual patient. Vaginal bleeding is not typically observed during a cesarean section procedure. Vaginal bleeding will be experienced. Following a C-section, it is typically observed that there is a decrease in certain aspects. One contributing factor is that throughout the surgical procedure, efforts are made to eliminate the presence of blood clots and other related substances, which are located within the uterine cavity. Another important aspect to consider is the circulation of blood to the uterus. The level of hormone production experiences a significant increase during pregnancy, thereby facilitating the growth and development of the fetus, as well as providing necessary support to the placenta. Following childbirth, there is a steady decrease in blood supply to the uterus. This phenomenon is the reason behind the presence of additional blood circulation. The process of uterine contraction persists and subsequently diminishes gradually, leading to the restoration of the uterus to its original dimensions. Thank you all for tuning in today. If you found this information helpful, be sure to like and subscribe. And as always, feel free to leave your comments or questions below. Until next time, stay healthy and happy and have a safe and joyful pregnancy journey.